One of the main reasons that we decided to undertake this comparison between COVID-19 and antimicrobial resistance is that in addition to the fact that inappropriate use of antibiotics for COVID-19 and widespread use of antimicrobial cleaning products may actually be increasing the rate of AMR, COVID-19 has also really shown us the consequences of not being prepared to address an emerging health threat. And AMR is certainly an emerging health threat that needs more attention from the global community. We really wanted to explore some of the ways that increasing levels of AMR will resemble the impacts of COVID-19 if we don't act now to prevent them. So we looked at AMR and COVID-19 from 3 different perspectives, and the first is the health system perspective. So with COVID-19, there were obviously a lot of additional demands that were placed on health systems, leading to really difficult questions about prioritizing care for certain patients or certain treatments, and it also made it more difficult for people to access ongoing or routine care. And this is actually going to be the reality for AMR as well, as it is expected to result in longer hospitalizations, higher morbidity, and higher mortality for conditions that were previously considered treatable. So this is particularly true in low and middle income countries, where rates of AMR are expected to increase much more quickly than in high income countries. The second component was economic and social factors. So COVID-19 has had a huge impact on the economies around the world, and AMR is expected to do the same thing as people take more time off for sick leave and recovery time, and this is going to be especially problematic, as with COVID-19, for industries that require a lot of human interaction. And we also found, in terms of social aspects, that the impacts of COVID-19 have not been equitably distributed, where women have had to drop out of the workforce at much higher levels than men. And historically, what we've seen, and we may see again with AMR, is that women are often left out of the dialogue around health crises, and so this is certainly something that we need to keep in mind when dealing with both crises. And lastly, we looked at the global political implications of COVID-19 and AMR, and especially early in the pandemic, many countries imposed really harsh travel restrictions and barred exports of medical supplies and other things, which runs counter to the international health regulations. And because AMR is a global concern that requires international cooperation, which unfortunately broke down as we saw during the initial stages of COVID-19, as countries were trying to sort of keep the virus from spreading within their borders, we need to really assess whether our current approaches to international cooperation can be depended on for addressing AMR and other public health crises. We developed a series of recommendations for each of the dimensions that we explored. And first, there needs to be a major strengthening of health systems that will allow them to be better prepared next time that there is increased demand on the system, because that will happen and they need to be prepared. So that means increasing capacity both in terms of patients and in terms of laboratory testing, and also ensuring that there's adequate training and equipment for both personnel and for patients, and then proactively working also with communities to prevent resistant infections from happening in the first place, because that way you can avoid that extra demand on the system. Second, there needs to be early action taken to strengthen social safety nets. Studies have shown that early investments can go a really long way in terms of protecting the economy. And worker protection should be strengthened, and increased support should be provided for medical and caregiver leaves of absence that we anticipate coming along with increased AMR. We also need to ensure that gender considerations are factored into those discussions, and that women's voices are really meaningfully included, because historically they have not been, and as we've seen with COVID-19, they have been very drastically impacted by this pandemic. Finally, we should look into the feasibility of a coordinated global response to a health emergency and make changes if we need to, because we need to be actually really open to thinking about changing things if they are not going to work, because we have a very interconnected world. Diseases don't recognize national borders, and even the strongest health systems are only as prepared as our most vulnerable counterparts. So we just want to leave with the message that AMR is actually often viewed as a slow-moving disaster. So while many of the things associated with COVID-19 could result from AMR, we've actually been given an opportunity through COVID-19 to look at the areas where we failed and where there were gaps in response and address those going forward, so that we have a chance to rectify some of the worst possible consequences of AMR before it's too late.